And these videos are always for me. If you find it nice and helpful, good for you. If not, just ignore. All right, let's talk about health assessment today. And it's going to be head to toe assessment. Let's start. Morning, such. My name is Maria, and I will be going to do your head to toe assessment. So you have a very smooth and even well-balanced gait with symmetrical arm swing. From our conversation earlier, I noticed that a few things. You look well-groomed, clean, comfortable, dressed appropriately for the season, and you knew your name, where you are, um, and also you were answering my questions appropriately. I noticed you oriented, spoke articulated, very well, and affected. Your affect was consistent with your mood. I see you sitting erect and relaxed. And let me go over your vital signs. They are normal. The blood pressure 124 over 84. Pulse is 66. Respiratory rate is 14. And your temperature is 98.4. I have all of my equipment ready and I washed my hands, so let's begin. Would you please stand? I'm going to do a couple tests for your coordination. Close your eyes, put your feet together, and put your arms up. This is a Romberg test to test your balance. Good. You have a little slight swing, which is normal. Now, can you take your hands and flip them over and over very fast? All right, like this. On your feet. I mean, on your legs or thighs. All right, very good. This is random alternative movements. Okay, while you're still standing, I'm going to check your spine, do some movements, check some movements. Could you slightly bend over and go up very slow? Thank you. I see your shoulders stay in line with your gluteal folds and iliac crests. Your spine and vertebral column is straight, midline, scapula even, and I don't see any sign of abnormal curvatures such as kyphosis, lordosis, or scoliosis. All right, you can sit down. Your skin is tan color. Your hair distribution is even. Temperature is nice and warm, except your fingers. They're a little bit cold, but I don't see any cyanosis. Your nails are clean and well manicured. I don't see any clubbing. And capillary refills are immediate, less than 3 seconds. When I touch these joints, do you feel any pain or tenderness? I don't see any swelling, erythema, or warmth. All right, I'm going to put some extremities through some movements to check your range of motion, active range of motion, and you just repeat movements. Shoulders, extension, flexion, extension, abduction, adduction, external rotation, and internal rotation, and circumduction. Good. Do you feel any pain, any crepitus or discomfort? Your elbows can do only 4 things. You flex, you extend, supinate, and pronate. Your wrist can do a flex and extend. Sometimes you can do hyperextend, radial deviation and ulnar deviation, and also opposition. All right, fingers, flex, extend. You have abduction and adduction. Right, so we did some range of motion of your upper extremities. They are within normal limits and no limitation. Now we're gonna check your strength. So you have to push against my pressure. So I can just do different things with a patient. Squeeze my hands, and the muscle strength is equal bilaterally 5 plus. All right. Well, I'm going to be on a half top of your body. So let's do head and neck range of motions. You have flexion and extension, lateral bending, and right and left rotation of your neck. At the same time, I want to see the strength. So just push against resistance. Very good. Now we're going to inspect your head. Is it okay for me to touch you? Okay. You have a clean, shiny, evenly distributed, beautiful hair of brown color. I feel that your cranium, and I see it's a normal cephalic, no bumps, no lesions, no craters. Do you have any tenderness? I see that your ears are evenly placed on both sides, your pinna evenly aligned with lateral canthus of your eye. Can I touch this ear? Okay. Any tenderness? No. I don't see any lesions or obvious swelling. Color is constant with the rest of the body. And I don't see any drainage from the external canal. And let's try to do some tests. Okay. I'm going to stand on one of the sides. You're going to close the ear on another side, and I'm going to whisper behind you a simple word and tell me if you hear that. Apple. Let's do another ear. Green. Okay. Another test is going to be your Weber and Rhine. I'm going to use a tuning fork. When I hit the tuning fork and put it on the top of my head, I'm going to ask if you hear that bilaterally, or one ear is louder than another. That would be the Weber's test. And the Rhine test, I'm gonna hit the tuning fork, put this on behind your ear, and then you will tell me if you stop hearing it. That's a conduction, bone conduction. And then after you say yes, stop, I'm gonna put this fork right next to your ear without touching it. You're gonna continue hearing it. And when you say stop, the air conduction should be longer than bone conduction. This also testing acoustic cranial nerve number 8. Let's move on to your eyes. There will be some testing of your eye movements. So the first, I'm going to check your acuity of the with a Snellen chart. And have a 6 feet away, and you're gonna say what you see. So it should be a 20/20. So what at 20 you see the normal person see at 20. That's the numbers. Then another test is Heisenberg, and that's for the near vision. So you can have this paper with written information and see if they have any trouble. That's near vision. Also, extraocular movements. I'm gonna say, go ahead and look at my finger, and you just go to different sides, however order you want. This is extraocular motor, and then accommodation. All right, so with the eyes, you're checking your cranial nerves as well for the acuity of vision. That will be optic nerve. Number 2. Okay, and for extra ocular motor, you're using 3 cranial nerves. Is 3, 4, 6. So 3 is going to be oculomotor, trochlear 4, and obtuscent. I apologize, not extraocular motor, but movement. While I'm on the face, I also can check cranial nerve number 7 for facial, and which is facial for facial expressions. Can you please show on your face a surprise or smile? Can you show that you are sad? All right. Moving on. Your eyebrows are present bilaterally and move symmetrically as a facial expressions. They are full and evenly distributed. Can you close your eyes? Good. Open up. All right. I don't see any signs of ptosis. And you have evenly distributed eyelashes. They are curved outward. Can I touch your eyes? All right. Your conjunctiva is pink and moist. Your sclera is white with few blood vessels, but no any kind of abrasion or erythema. Your cornea is transparent, and I don't see any shattering with pen light. I would assume I shine it. All right, you have a nice brown irises or whatever color. I'm going to check your for perla. This time I'm going to shine also a light pen in the eye and checking for direct or indirect light reflex, looking at the pupils, how they react. So perla is pupils equal reactive to light and accommodation and round. So PERRLA, pupil equal, round, reaction, light accommodation. So your pupils are about 2 millimeters. They are equal, round, and they react to the light. If you look straight, please, I'm directing the light at the pupil and see constriction on both sides. And when I close or separate my sides and I shine in one eye and I see the constriction in another eye, that is indirect or consensual light reflex, 2 plus. All right. Good accommodation. When I say that you're looking at my finger and I go to the nose, I see not only constriction but also movement of the eye toward the nose. All right. Also at this time, I probably will have ophthalmological instrument, ophthalmoscope, and a look into the eye very close to see any retina, any light, any signs of hemorrhages. All right, moving on to the nose. It is midline, non-deviated, no perforation. Could you cover your nostrils? Very good. They are patent. And I'm going to look inside. Your septum is midline. Nasal mucosa is pink and moist. I don't see any redness or polyps or lesions. I can see your turbinate and nates, and they're also pink, moist, and with no discharge. So I can check our wonderful olfactory cranial nerve is number one for the smell. Let's move on to our mouth. Your lips are moist, smooth. I don't see any presence of cheilitis. Your gums with no receding redness, abrasions, or swelling. Can you please open your mouth? I see you have beautiful white teeth with pleasant halitosis odor. I don't see any cracks. Your buccal mucosa is also pink, moist, with no lesions. Your tonsils are visible, 1 plus, but no redness. I can see rugae on your hard palate. Your soft palate is pink and smooth. Would you lift your tongue, please? Your frenulum is intact, highly vascular. Would you stick your tongue and say ah? Ah. Also checking with this movement of sticking tongue out, cranial nerve number 12, which is hypoglossal, as well as a 9 and 10, which is vagus and spine, vagus and glossopharyngeal. For when I say ah, I'm looking at the midline uvula rays. Right, can you lift your chin, please, and swallow? Your trachea is midline and it rises and falls with swallowing. I don't see any bulging that indicate thyroid enlargement. At this time, I probably will do the testing of the, not testing, but assessing the thyroid. You can do either anterior or posterior, which is, we already told them to swallow. Now you're gonna palpate, find out where it is. Go ahead and swallow. And you can feel the movements. You also can push on one side and kind of palpate on another side. Do it on bilaterally, and also ask at the same time to swallow. If you see any abnormality, then that's a problem. All right, let me see some lymph nodes. They are associated with the mouth, jugular gastric, submandibular, and submental. Any pain? So you, of course, palpate both sides. Good, they are non-pulpable and with perfectly normal. Moving on down to the lungs. I'm going to the, first of all, I see that you sitting and breathing effortlessly. And I'm going to listen to your lungs. I hear the vesicular sound at the apices and also at the lung bases. Your bronchovesicular sound between scapula, and also I hear that your right middle lobe, right under there, on the side. Right, good. And if you need to bronchial sound, that will be right here on the neck. Okay, I don't hear any crackle or wheezing in your lungs, which is good. So let me do some touching, which is supposed to be right before you're listening. So you're touching for any primitives. You can also say, can you say 99, 99? So it's going to be like a muffled sound. You do the same thing on the back, on the posterior. And you also can do percussion, which you just go and see how it feels. Of course, if you hit any organ, that will be dull. And timpani, if you have some kind of guts, so you will know this is your abdomen. But resonance, that's what you need to hear. All right. We already did everything with the lungs. You can also, stand behind, put this on a lower back, a little bit closer to the 12 ribs in the middle and tell them to take a breath. And they need to raise up symmetrical. Let's move on to the cardiac. Then seeing the signs of jugular vein distension. You have slight pulsation at your carotids plus 2 plus. Rhythm is steady and equal bilateral. All right, inspect your pericardium. I don't feel, and touch it. I don't feel any thrills. I can feel your PMI, which is fifth intercostal midclavicular line. And then it's about 2 centimeters, very good. And now I'm going to listen to your heart. Let's see if I can. That one. I'm going to find your angle of Lewis and the second intercostal space, aortic, where I can hear second S2 louder than S1, pulmonic, Erb's point is equal, tricuspid, S1 louder than S2, and mitral. So I'm going to change from diaphragm to the bell and go back and listening to the same thing. Good, and I don't hear any abnormal sounds or murmurs or bruits. So let's go to the abdomen. You're going to cover with a towel, lift the shirt, and of course when you listen to the heart and lungs, you don't have the shirt or have a gown, but you listen to the skin. So your skin again is even tone, consistent with the rest of the body. Your umbilicus is midline, slightly darker. You have even hair distribution, no lumps, masses, scars, lesions, or bulges. Your contour is slightly rounded. I'm going to auscultate your bowel sounds. Oops, like that. I'm going to start with right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant, where I hear, oops, your barbarugmas. Sounds good, and they are active. At this time, I can also palpate because we already auscultated. Very gently palpate with one hand on your abdomen, and then you're going to deeper palpation with using 2 hands. And you can also do Murphy sign when you go into the on the right upper quadrant to see if a person with inhaling, if they have a pain, which can tell us that something going on with a gallbladder. On McBurney point, this is on the right lower quadrant, which if you have some pain, that will be indicative of the appendix. There is another test that you can do that is, not sure if I recorded, but anyway, let's go again. So a Ravsing sign is going to be when you lay down and you press on your left lower quadrant and you have a pain on your right lower quadrant. That's indicative of appendicitis. Another things that you can do with laying down is psoas, and it's a pain occurring during maneuver when you're laying down on the lay down and you raise your right leg against the pressure with which I pushing on you, so you will have that pain on your right lower quadrant, as well as obturator sign when you lay down and the doctor or whoever is doing is pain with maneuver of the flexion of the knee and the hip. When you go a little bit inverted, then that's the sign of appendicitis. Another sign is the Markle test, heel jar test, when you say lift yourself on the toe and then drop your heels. And if you have the pain on the right side, that indicative of the appendicitis. To the legs, you can sit up. And the palpation of the abdomen would be supine with knees bent. Okay, so with legs, you have a clean, fresh shave. Skin is smooth and skin tone consistent with the rest of the body. Muscles are equal bilaterally, no signs of atrophy. Temperature is warm, even bilaterally, and no edema is present. Capillary feel is instant in the toes. When I touch your knee joint, any pain? How about ankle? And let's check your pulses. Dorsalis, pedis, posterior tibial, femoral. They are good, all 2+. All right, I'm going to do some range of motion of your lower extremities. With the hip, you flex your knee. Abduct, going away. Adduct, going toward. External and internal rotation. So your knee is going to be toward. That's the internal rotation, and external is outward. Your knee, you have a flexion and extension, that's all. Your ankle have dorsal and plantar flexion. So when you put your toes toward you, that's a dorsiflexion. You also have inversion and eversion. So inversion is when you go this way, and then eversion when you show your soles outward. All right, with feet, you spread your toes, extension, you curl your toes down, that's flexion. Also, leg and foot, we're checking for the ankle, I told you that, and also circumduction. Here you go. So you go around. We also check your resistance of your legs. Push against the resistance. Good. All right. Also to mention, when you observe how a patient is walking, you check for the gait. You also check for the gait when you say put your feet to the toe. Also check for sensory system. So you can choose to touch the patients bilaterally with sharp or dull, or they feel it. Testing for some things like carpal tunnels, you have to test Fallon and Tinnen. Pronation drip. So when you say close your eyes and you do prone, standing like this, if they have drifting, that's also indicative of some neurological issues. For meningeal irritation, you have 3 signs. Is a nuchal rigidity, so the rigid neck. You have Kernick sign and the Brzezinski. Brzezinski, when you lay down and you put your head down, flex it, and you have the pain. As well as you reflexively flex your hip. And then Kernick sign is that when you flex the patient hip at one time and attempt to straighten the leg at the same time and lifting it up, but positive will be the resistance of leg straightening because the painful in the hamstring due to inflammation, incomplete of back pain. Right, I hope I did include all of the things that are there. Maybe not, but that's the majority. So